We are in an era of AI. Do it, it will reduce the need for doctors and it is
Yeah, maybe I will be replaced by a robot. Uh,
for in doing for medicine was the trading or the
at this time, unfortunately, there's no proven research-based information that naturopathy or homeopathy or Ayurveda or any other forms of, high doses of vitamin C, for instance, that these can cure cancer. There are a lot of claims. There are, for example, naturopaths, and I have attended their talks and their seminars. They say, for example, that if you have cancer, stop eating everything, just eat grapes and lemons for 6 months, and your cancer will go away completely. And I have met people who have told me that, oh, Dr. May, I had brain cancer, and for 4 months, I ate nothing. I only drank carrot juice, or I only drank orange juice and nothing else. And I lost a lot of weight and my cancer went away. I mean, I don't know. I don't know what happened in those cases. I don't know if maybe the cancer came back. I don't know if it truly disappeared or not. But as far as research shows, as of now, I would tell my patients to, if they really want to get cured, they should go for modern medicine. They should go for chemotherapy. They should go for surgery, depending on the stage of cancer. Unless they want to take a risk. Some people say, I don't care. Even if I die, I don't want to do chemotherapy. I'm going to try natural methods. They're welcome to do that. Each individual is free. They should be given all the information by the doctors. Will say, if you do chemotherapy, then the chances are 5% that your cancer may come back, but 95% chance that you will be cured. So the patient might say, okay, so I will try chemotherapy. So again, it depends on what information the patient is given and what they decide to do. But also, I get very sad that some people are taken advantage of. Somebody is about, very worried that they have cancer, and some people try to make money and lie to them and say, oh, if you try my treatment, it costs lakhs of rupees, thousands of dollars, but it will cure your cancer. So sometimes people lie and take advantage of people in vulnerable situations.
we know involved in a normal cell. Why y no podemos me y la en
Um, it really depends on the kind of cancer. Now there's been a lot of research and newer drugs are being made which only target the cancer cells. So there is a specific medicine for lung cancer, for certain types of lung cancer, for instance, that only targets the cancer cells. Also, some forms of blood cancer. There's a medicine which is specific for the cancer cells. So it has very few side effects and it's very efficient. So hopefully with more research, they are developing many other medicines for even other types of cancer so that they can be as specific and only target the cancer cells.
the food and the was the benefit of my life that in some already for the me the body harm what would you say about that?
Yes, you know, in olden times, like 300-400 years ago, even Western medicine was using potentially toxic substances to help treat diseases because they didn't really have an option back then. So in Ayurveda, there are certain herbs which are called the ras. So they actually contain mercury. Mercury is a heavy metal which is potentially toxic to different parts of the body, like the brain, the nerves, and other organs. So in India, it's legal and it's still used. But lead specifically, I think also the United States and also European countries, they are very careful about any traces of toxic material in herbal or natural products. So when they actually process the herb, like when the farmers grow it, and depending on what pesticides are used, whether those herbs are grown organically, and also when they are dried, they are stored, sometimes they get contaminated by fungus, or they're not processed in good quality machinery. So you have these toxic substances which get mixed with the medicine. So the US, Drug Administration, they are quite strict with that, and they test. So you can't just export Ayurvedic medicines from India to the United States unless they are tested, and they have to meet those guidelines and those strict requirements. So that's something unfortunate. So I personally, when I use a lot of Ayurvedic herbs myself. I make sure that it's from Himalaya, the company Himalaya. They out of all the different brands, they are the most careful, and they do a lot of research, and they make sure that their product is pure and free from contaminants. So that is something we should be aware of.
I already made it one of the one of the many how can it for new diseases.
Many of the herbs which are used actually have active ingredients and compounds, molecules, which are helpful for all diseases. You will be quite surprised to know that many of the medicines that we have in modern medicine were actually derived from plants originally. So these plants have the active medicinal compounds, which can affect the body, affect the brain, affect the heart, and cause certain so the difference in this case between Ayurveda and modern medicine would be that the pharmaceutical companies, they extract the active ingredient from the plant and they modify it in a way to make it more potent and more effective. But in Ayurveda, they use the whole plant. They dry the leaves, or they take the branches, they dry them, then they powder them, then they mix them, they boil them in milk, or they tell the patient to, so they use bigger parts of the plant. But it can still be helpful because most illnesses, most diseases have been present for thousands of years. There are very few diseases which are new. And the new ones are usually viruses which get transmitted from animals to humans. For example, we saw the COVID virus came from bats, or the HIV, the human immunodeficiency virus, it was transmitted from monkeys to humans. But even in these so-called modern diseases, if the immune system is made strong and if you have a healthy body, then it can have less of an effect, less of the more severe symptoms of COVID, for example. HIV is a little different. It's a very dangerous virus, but then there are many effective medications for it. And also in HIV, people, there's a difference in the way that they respond. Some people just naturally, even though they get the virus, their body gets rid of it, of itself, and they become negative. It's very rare, but genetics, your immune system, all of this plays a role. So Ayurvedic medicines, if they are pure and not contaminated and used properly, they can help boost the body's natural immune system, the body's natural system to heal itself, and so they can be effective even in modern diseases.
We are in an era of AI. Do it will reduce the need for doctor and it is
Yeah, maybe I will be replaced by a robot. Uh, I don't know. I'm actually, to be honest, I'm more interested in history than in the future. Just my own personal hobbies are more linked to things from the past, like to read um, writers from 200 years ago, or to read about the history of long time back. So I have not really kept myself in terms of knowledge. I don't know much about AI or to what extent it can be helpful. I'm not a big fan. But I still think that even though artificial intelligence can use certain algorithms to come to certain decisions based on, you put in all the symptoms: cough, fever, chest pain, sore throat. And then it may say, oh, you might have bronchitis. You should take this antibiotic. But it will not replace a doctor who can actually touch you, who can listen to your lungs, who can see how you look, who can interact more in terms of what are your personal beliefs, what are your likes and dislikes, or a doctor who has seen you for many years and is familiar that, you know what, usually if Anand gets a little bit of a cough, it usually resolves by itself in 2 or 3 days. So I don't need to give him an antibiotic. So I don't think AI can have that personal connection or that personal touch.
for more people it is deeper for medical advances you have some thought on how to solve the problem.
Yes, how to help get healthcare for more people. This is a difficult question because it is a debate about whether healthcare is it a right? Is it a fundamental human right? Or should people have to pay for it because a lot of money is required for the research that is done to develop new methods of treatment, to develop certain technology like pacemakers or hemodialysis or certain sophisticated treatments for cancer. So it becomes a more philosophical or spiritual question about how important this life is, because we are all eventually going to die one day. But in terms of fairness and justice and human rights, I believe that everybody deserves basic health care. So when I see a 95-year-old in the United States getting a very expensive procedure, or for example, getting a pacemaker, which costs hundreds of thousands of dollars for the treatment, for the procedure, for the doctor, for the instrument. And then you have small children in a village somewhere in the developing world dying because they can't afford $10 for antibiotics or basic, clean water or mosquito nets to prevent malaria. then it's definitely a big injustice. And I think there has to be more awareness between within governments and also the common population. There should be a willingness, because it really depends, because different countries have different systems of healthcare. A country like Canada, for instance, or the United Kingdom, the government provides healthcare and it gets the money for it from the taxes. So people pay higher taxes, but everybody gets the basic treatment. However, that also has its problems, because people have to wait, because there's not enough doctors, there's not enough hospitals. So they have to sometimes wait for months to get a treatment or to get a test done. And countries like the United States, for example, they say, no, I want immediate relief. I want immediate treatment. So then they say, I will pay for it. I'm willing to pay insurance. I'm willing to pay thousands of dollars, but I want what I want right now. But even in the United States, there are people who are poor, who can't afford healthcare, who can't afford insurance, and they die, or they become blind, or they lose their kidneys because they couldn't afford certain medications. So the government here is trying to help that by reducing the cost of certain essential medications. But then if you look at a country like India, for instance, it's a completely different story. It's, getting adequate healthcare is a matter of how much money you have.
Yeah.
So a poor rickshaw puller or an auto rickshaw driver, if his wife or child, for example, gets cancer or some other life-threatening illness, and if they don't have hundreds of thousands of rupees to spend, then the family member unfortunately has to suffer and die. They don't have the money, and it's the poor child, those children become orphans, or the family members who are left behind. Let's say the father dies, the children are very small, the wife can't earn, maybe she's not educated, so a whole generation suffers because they could not get adequate health care. I know there are many organizations, there are non-governmental organizations. There's the World Health Organization, which has a lot of programs for vaccination to make sure that people in poor areas have access to basic health care. So this is one of the goals of, all the countries came together and said, we need at least basic health care for everyone. But to get sophisticated or expensive treatments and procedures, that is still a luxury in many countries that not everybody can afford. It's a very complicated situation, and there's there are a lot of differences, depending on what country or what area of the world we are talking about. But most governments have a basic budget for the poor to help them. But then, of course, there's a lot of corruption and mismanagement and waste of funds. And the people who really need that help, they do not receive it. So that's another question completely. It's not just a medical problem, it's also a social problem, it's an economic problem, it's a political problem. So it's quite complex.
Budu lalu some on in for our
Sure. I really would first like to thank you, Anand, for your beautiful, well thought out questions. And I hope that I could make an attempt to answer to the best of my capacity. One thing that I have learned in my more than 20 years in the medical field is when we as patients, when we go to a doctor, we should not feel intimidated or afraid to ask questions, because that is the first step towards taking care of our health. So we shouldn't feel afraid. We should make sure we understand what the doctor is saying. What are the results of the test? We have a right to know, to ask, to be explained. And if they are prescribing any medicine or if they are recommending a surgery or a procedure, we should ask about it. What are the risks? What are the possible side effects? Because as a patient, we have the right to know. And we are not just passive, dumb people that,
No.
okay, whatever the doctor says, I'm just
No.
going to follow that. And the other message that I would like to give is the importance of spiritual, emotional, and mental well-being. That is also a part of health. The way we go for our dental checkups or a physical checkup, it's also good to be aware of our psychological health.
Yeah.
And if we feel depressed, if we feel discouraged or sad or pessimistic about life, feeling hopeless, or we are facing a situation where we feel we are being treated badly or bullied, we should ask for help. We should reach out to someone that we trust and ask also. There's no shame in asking for psychological or emotional support. That is very important. It's an important part of health, which should not be ignored.
Thank you for the information shared and your valuable time.
Thank you, Anand. Thank you for your valuable time and for choosing such interesting and pertinent questions. I really enjoyed speaking with you. Thank you.
Bye for now.
Bye-bye. Take care.